It's a pleasure and a privilege for us to be here today and discuss this timely and impactful topic of engaging youth and young people in as change agents in SRH, especially in humanitarian settings. Youth engagement. Out of 8.2 billion people in the world population, 300 million will require humanitarian assistance. It's important to realize that and recognize the realities of the young people during emergencies. According to 2019 UNFP study, about 9.7 million people are affected by the young people are affected by crisis. About 60% has shared that their expressions are not taken into account in decision making during crisis. The disruption of healthcare results in limited access, rise of gender-based violence, and unintended pregnancies and unsafe abortions, which all of this would affect the youth during crisis. IPPF has introduced the Come Together strategy for 2028. IPPF finds youth engagement and participation as critical to strengthen communities' capacity. This mini symposium will explore ways in which engaging youth in humanitarian responses is viewed and applied in different types of crises. So today we have four very impactful and insightful youth volunteers who will be sharing their experiences and insight from humanitarian settings. So first, we are joined by Angelica Urot. So Angelica, to tell a little bit about Angelica, she is a youth volunteer from the Family Planning Organization of the Philippines. She is a young volunteer who advocates with FPOP Surigao chapter, where she leads the efforts to raise awareness on key issues such as HIV, AIDS, teenage pregnancy, gender, SRHR, and leadership in stable and humanitarian crises. She has experience in supporting Typhoon Death response, where she supported the SRHR services and support to affected youth. Next we have Merlinda Jimenez from Indonesia Planned Parenthood Federation. Merlinda is a youth facilitator and a logistician during the SRHR disaster response in Sabu Rijua, Indonesia in 2021. Currently, she is actively engaged with young people in East Nusa Tenggara through the PKBI NTT Youth Forum. With a focus on youth capacity building and community organizing, she is committed to contributing to raising awareness and increasing youth participation in SRHR. Finally, we have Mahalakshmi. Mahalakshmi is a youth volunteer and a branch steering committee member of the Family Planning Association of India. And she's also a member of the South Asian Regional Youth Network, SARIN. She has a master's in social work and she's a Teach of India Fellow. And she has done impactful sessions on comprehensive sexuality education across diverse communities, including persons with disabilities, rural areas, and urban slums. So, welcome to all three of our very important, impactful panelists. So, how was your experience in contributing to a preparedness plan in emergency?
As one of the youth volunteer of the Family Planning Organization of the Philippines, I have had the privilege in contributing to the emergency preparedness plans last December 2021. Our area was directly hit and we were one of the victims, but still we are determined to deliver the services. We ensure that women and pregnant individuals still have access to sexual reproductive health services. We distributed safety, hygiene, and maternity kits, and we did discussions and lectures. We also worked closely with the affected youth to address mental health concerns.
So, can you also give us examples on practical activities of engaging adolescents and young people in SRH and SGBV in preparedness plans?
We implemented community-based discussions and advocacy efforts tailored to the adolescents and young people to provide them vital, accessible information. We create safe and open spaces for them to share their concerns and experiences because it ensures that we are able to build trust and ensure that these people have the right support. We also recruit youth volunteers. These volunteers undergo thorough orientation process that prepares them to join our outreach. These volunteers ensuring that services are accessible to those who are most vulnerable. We also closely collaborate with the local government to implement referral systems to ensure that access to medical, legal, and psychological support. This holistic approach that we do with the youth and with the engagement of the youth ensures that no one is left behind. We are able to create a safer and more supportive environment.
What are the lessons learned that you can share with us about engaging youth and young people to sensitize them and all of that during preparedness planning?
One of the important lessons that we learned is the importance of youth-friendly communication that we find effective, engaging, relatable, and easy to understand. We really give materials that we create. It would connect to them, to their cultural and social backgrounds. We are able to empower young people to understand important topics, the importance of providing supportive environment for young leaders. And support can come in various ways. Their ideas that resonates with their peers. We should be responsive and flexible to the changing needs. Sexual reproductive health and sexual and gender-based violence are constantly evolving due to a lot of factors. Applying these principles, we can better engage and inform our young people to a more successful outcomes.
Melinda, how do you describe the contribution of youth networking in emergency response?
My friends and I from the IPPA chapters is Nusa Tenggara Youth Forum were directly involved in organizing youth boys and girls in the disasters affected villages. We managed form a youth group. We made thematic discussion classes. We discussed various topics related to the sexual reproductive health. We utilized the afternoon to conduct our session. Youth from the aforementioned group actively become youth facilitators who guide the discussion.
So, how would you build trust within the communities during the humanitarian crisis?
The disaster location we visited certainly have differences in cultures, language, regions, and habits. Nusa Tenggara is an archipelago province with 21 districts and 1 city. 72 different local languages. It takes about 12 hours to travel from the provincial capital to the disaster site. But our one passion is to help. We approach religious leaders, community leaders, and local governments building a youth-adult partnership. We were introduced to young people there who were willing to accept us and willingly engage in various activities that we design together. We try to be their friend without discriminating against them. They also actively plan thematic discussion activities with other youth in the disasters.
Mahalakshmi, so can you describe how the youth voices remain central in SRH advocacy and in service delivery in the humanitarian context?
Youth undoubtedly is one of the most vulnerable populations when it comes to humanitarian crisis. Young people who belong to LGBTQI+, sex workers, persons with disability often forget it. People in SRHR becoming the center, they have witnessed those crises, have the ideas how to combat. Young people would be more able to resonate, understand the challenges, and bring out the solutions. Youth are not monoliths. They have diverse opinions, they have diverse needs.
What are the innovative approaches that you have seen useful in engaging the communities that you serve?
Talking about reproductive health is still very taboo. We start the discussion process in a fairly careful by identifying what the physical changes when he becomes a teenager. We were able to draw the male and female reproductive organs. They become very happy that they could learn decision, and at the end, they become very proficient. We design a participatory method for each group member. We use the game method. They still get the knowledge, but in a fun way. Children's under 10 years old, we use puppets, conveying information about preventing child sexual abuse through the storytelling method. We try not to use a lot of brochure or paper made of paper because we don't want the additional weights at the disaster site.
How do you see the role of youth evolving in the future, SRH and humanitarian settings?
Youth is already the center. Youth has always been asking for the seed and has got the seed. Youth has the decision making and leadership roles. They have the authority. We need experience from you guys. Youth needs your support, your learnings from your experiences. Has to have accountability on ourselves. We often have the habit of doing very creative stuff. When we talk about humanitarian crisis, comes to our mind is the physical effects, food, essential items. We are talking about menstrual hygiene management. So we have to have that intersection. HR has been a very diverse topic. What if youth is trained as peer educators, youth is trained as peer counselors? Fascinating to have someone like you of your age talking about your needs.
In your ideal world, what does youth inclusive functional preparedness look like?
Youth needs seat, youth needs say, and youth need learning from your experience. Good. We need experiences. We need to be equipped. We are more than happy if you teach us. We need your support and preparedness. Equip us with necessary skills. There are diverse cohort I can see in the back, youth sitting, and who have come here because they have done a lot of ground stuff. They have given menstrual hygiene management trainings. We need support in terms of what preparedness, which are more relevant to the 21st century. We are like technology wise, digitally, with the changing global scenario, it is more digitally driven. It is more about, especially after pandemic, at the last, we all are human beings. We are all fighting for human dignity. We are all fighting for human rights. Yeah.
How would you envision how the youth would interact in the humanitarian settings in the future?
Young people are not just mere beneficiaries of the programs, but they are actively shaping policies and initiatives. I see a future where youth leadership is fully integrated into the decision-making processes at every level, ensuring needs of the adolescents. Empowering young people, we can ensure or we can create a more inclusive and sustainable future, one that prioritizes equity, education, and accessibility.
Youth should not be counted as a part of problem, but recognize abilities and qualities and give them space for meaningful participations. Well capacitated will be able to produce innovation and creativity.
Encouraging peer leadership from the community itself. And just to conclude, it is never about youth if it is without youth.